Hi everybody, it's David Porter. I'm going to make a little adjustment in the camera. Here comes the hand. There we go. Okay, in a previous video I did on Introduction to CBT, Cognitive Behavioral Therapy, I mentioned two mythical characters, Harry and Larry. And the example was, there's a blizzard coming. Harry is in a state of acute anxiety about it. Larry is in a state of acute anticipation about it. He can't wait, where Larry is dreading it. And this little anecdote is a classic example of how cognitive behavioral therapy works. The idea is that there is no situation which is inherently stressful. Rather, it is our perception, our POV, our point of view about the situation that renders it stress-inducing or not. This is why it's part of the reason why people have specific phobias, is what they're called. Some people will be terrified of dogs. Even a very friendly little dog will terrify them, put them in a state of panic, because by definition, a specific phobia is an irrational fear around a specific stimuli. That is a situation or object, a dog. Whereas someone else is going to be, so happy to see the dog and want to say hi to the dog and pet it, and the dog is going to be wagging its tail and be, happy to get the attention. So again, here we go again. You have the same situation. We have a friendly dog, wagging its tail, wants some pets, and one person is going to be in a state of anxiety and fear, outright, which could escalate to panic, and someone else is going to be so happy to see the dog and want to say hi and pet him. Specific phobias are number one, it's an irrational fear. The fear is not warranted for the situation and grossly out of proportion for the situation. And the fear tends to be around a specific object. You can have someone who is very brave and bold and courageous in 999 areas of their life except for one. And their courage and their confidence will just melt away like a chip of ice on a hot sidewalk on a July day in the Sahara Desert. Okay, I'm getting carried away. I don't even know if they have sidewalks in the Sahara Desert. I don't know. Whatever. Not important. Fucking ADD. Hang on. I need a sip of coffee. Hold on just 1 second. Oh, that's better. You can feel the synapses all grinding together and sparking, creating intelligence. All right. Where was I? CBT, cognitive behavioral therapy. Come on. Focus. You have so anyhow, CBT, cognitive behavioral therapy, and its root, the Greek philosophy of Stoicism, basically say no situation in and of itself is anxiety provoking or stressful. It is our perception, our interpretation of the situation. So back to Harry and Larry. Here's a concept that I have started introducing to my patients with anxiety a few months back, and I call it getting out of the chair. Because we're a patient, therapist, sitting in their respective chairs, having a discussion, talking, having a dialogue, and learning. And by the way, the therapist learns from the patient routinely, all the time. My patients teach me things and help me look at things from different perspectives routinely. So there's an exchange of information and reciprocal learning. And then the person learns techniques that they can apply to manage their anxiety. A lot of it is expectation management, expanding your expectations to reduce disappointment or frustration or anger, or you can use deep breathing techniques, diaphragmatic breathing, for real-time management of anxiety, of acute anxiety. You breathe in through your nose for a 4 count, hold it for a 4 count, open your mouth, let it out slow for a 4 count. One breath should take 12 seconds. great way to access your parasympathetic nervous system, which is the body's rest and digest response, and dial everything down when you're entering an acute episode of anxiety, which is sympathetic activation, that fight, flight, freeze response, where it can escalate into a panic attack, which just feels awful. Like you feel like you've lost all control. Many people who have told me that when they have panic attacks, the first time or repeated times, it feels like they think they're having a cardiac event, a myocardial infarction, even someone young and healthy, and they wind up ambulance emergency room because that's what it will feel like. The sucking air, the shortness of breath, the tunnel vision, the sweating. You can have chest pain, numbness, tingling in the hands, dizziness, nausea, vomiting. A panic attack is a feeling of utter and complete loss of control, accompanied by physical symptoms. So we don't want anxiety to escalate to that level, and the diaphragmatic breathing is a great way to shut it down. Another method is ice, or ice on the face, cold on the face. Another reason to do the dishes and keep the kitchen sink clear. If someone's having a panic attack, turn the cold water on, stick your head right in there. Stick your head right under the cold water. Watch your head coming up so you don't bang it against the faucet, get an occipital injury. And or you put an ice pack on your face, cold washcloth on your face. You're going to be constricting the blood vessels in your face, which is going to, one more time, send a signal to the parasympathetic nervous system to start dialing everything down. This method was, I don't know if they're the first ones to come up with it. I actually heard it was used in the, the conflict in Iraq and Afghanistan, where medics would use ice to bring down someone having a panic attack. So that's the kind of stuff that cognitive behavioral therapy will talk about, and also management of chronic anxiety. Keep the chronic anxiety down, and hopefully the acute spikes of anxiety will take care of themselves, or they won't climb as so high. So that's all well and good. All that stuff is very, very useful, but let's get out of the chair. Let's go back to Harry. Harry has a job he probably doesn't like too much. He's been late. He's chronically late for it. When a lot of times people are late for work because they don't want to go. His vehicle is in poor condition, so this job probably doesn't pay him much, or he doesn't manage it. Maybe it does, and he doesn't manage his money well. You got to do some preparation in life. You have to do. Today is the culmination of a series of choices you made up till now. And if you made good choices, your life's going to be in a pretty good place. If you made bad choices, not so much. Harry, get an exit plan from that job, okay? You're clearly not happy there, and they don't pay you enough. That's one possibility. Hold on a second. I know. You need an exit plan. You need to start looking for another job. You need to update your resume or your CV. You need to do some networking, some skill development. You may want to do a career change, but make an exit plan and get out of there. Don't be reckless and just quit. Don't wait for things to get so bad that they fire you. You want to leave on your terms, get a good reference, and just having an exit plan, knowing you're going to get out of there in a month or 6 months, is going to improve your morale. Number two, if they're not paying you enough, you need to find a higher paying gig, or a gig on the side, another part-time job, or a side gig where you can start making more money so you can afford to buy new tires and maintain your vehicle better. Or maybe you already make enough money and you're just not good at money management. Time to learn. This is why we have the University of YouTube and the Google Library, the largest library in history at our fingertips. There's no excuse for not knowing how to do things anymore, at least not soft skills like sound financial management. Because Larry would not be so anxious if, number one, he was in the good graces of his employer. He was a solid employee who was punctual and hardworking and efficient and had the right mindset and brought value to the workplace. where it would actually be difficult for the employer to fire him or get rid of him, because he's just such a high value employee. And that takes time to cultivate and a lot of hard work. Number two, learn how to manage your money better, or like I said, you're going to need additional income streams so you can buy new freaking tires for your vehicle and maybe get a 4-wheel drive vehicle if you live in a climate with blizzards. In another video, when I talked about safety on the road, personal security, part of that is how well equipped is your vehicle. Have, in the wintertime, some warm clothes in the car, an extra sweatshirt or hat and gloves, a balaclava. Have those chemical hand warmers that you open up the package and shake it and they warm up, keep your hands and feet warm. You have a good quality LED flashlight, a multi-tool, some Siloam sticks, that is the chemical glow sticks. You break them and break them and shake them, and then they give off a red glow. Have a good first aid kit in the car. Have some supplies in your vehicle that can help you deal with a potential emergency, and that's going to increase your confidence and dial back your anxiety. Having a vehicle in good repair, you just got the oil change, you've got new tires, you got a 4-wheel drive vehicle, you are going to increase your confidence and reduce your fear. You have a good job where you are a top performer and a valued employee, confidence, reduction of fear. And what are you doing with your money? Are you blowing it on shit you don't need? Or are you investing and watching it grow? Or do you have an emergency fund? That's going to help you manage your anxiety, because you know that if you have to, you can turn and walk out the door anytime you want. In an abusive or unsafe work environment, you have an emergency fund to sustain you. You have investments and additional income streams where if there is a problem at work, or maybe you're a great employee and you have a great boss and a great workplace, but there are economic factors beyond control and your place is laying people off or looking at like it's going to go under, you are going to have less anxiety than other people if you have that emergency fund tucked away in a money market account, if you have investments, if you have additional passive income streams, if you've been networking, keeping your resume up to date. That's what I call getting out of the chair. Not just, let's sit and do the deep breathing and reevaluate my expectations. Yes, that stuff works and that stuff is important, but you need to do more. You need to get up and move and take action. You need to get out of the chair and make sure you're doing things where you are prepared for adverse events in your life, and that is going to reduce your chronic anxiety. Theoretically, you manage chronic anxiety, you're not going to get those spikes of acute anxiety. You're going to sleep better at night. You're going to operate with more confidence because you're going to know, not just feel, know you have more options. Okay, those are just a few of my thoughts on this topic. Thank you for watching. Please be safe and please hit subscribe.